Welcome to another coMra Therapy Case Report Summary. My name is Garrett Myrne, and today's case is on fractured toes resulting from a car accident. This case was kindly submitted by Ms. Yuniya Trenko, a massage therapist and coMra therapist from the Ukraine. With respect to condition, we have a male who's 40 years old who had a car accident, and he fractured his right foot, resulting in obviously pain, bruising, and swelling. At the doctor's office, they did a physical exam and an x-ray, and the diagnosis was a fracture of the 3rd, 4th, and 5th metatarsal bones in his foot, and of course contusion of the toes with damage to the toenails. Here's a close-up of the x-ray one day after the car accident. You can see the fracture of the 4th metatarsal very easily. The 3rd and 5th require some more skill to see. And so with this, the physician prescribed a cast, a removable cast for 8 weeks with crutches and pain meds as needed. For treatment, the 980 nanometer Delta device was used. Traumatology 15 treatment was done. Of course, this was modified slightly, and you can get some idea of that treatment from the picture on the right. A treatment was done each day for 30 days, and the start of treatment was 1 day after the accident. If you want more details, please contact us. In terms of outcome, you see here this picture from 6 days after, and this is the first day that he took the removable cast on. For the first 6 days, he didn't want the bandages over his toes to be removed, nor the cast, and so Yuniya did the treatments through the bandage and the cast. Obviously, the bandage over the toes, they were still bleeding and stuff. So once he got to this point, he was okay to take the cast off, and this was also the day he had his checkup from the doctor's office. And this picture from the side, you can see the swelling and the bruising on the side of the foot and toes. And this picture here, you can see the instep, some swelling and bruising there as well. So here you have a picture from day 10. We're into the 2nd week of treatment. And Yuniya said that the doctor couldn't locate the fracture visually on the foot in that 2nd week. And so they did a repeated x-ray, and it showed the bones had healed together very quickly and correctly. And of course, at this point, the patient was walking on crutches, and he stopped taking the pain meds. And again, you can see the picture at the side. The swelling's a little less, as well as the bruising. And you can see here in the instep, there's still bruising, of course, but not as much. Now we go to the 3rd week of progress. So at this point, he's pain-free, and the swelling and the bruising are gone. And Yuniya reported that he was able to move through his house without using his crutches. And he said he leans a little on the heel as he walks around. And you can see here, this is day 16, so we're in week 3. And you can see the veins on top of his foot. So the swelling's reduced quite a lot. The toes are looking very good. And you can see the instep, just a slight discoloration in the instep. And here you can see a comparison between day 1 fracture and day 34, that x-ray on the last day. At this point, Yuniya's client was no longer using the cast, and he was walking without crutches. At the end of the 4th week checkup, the doctor was actually really surprised because when they did the x-rays, he couldn't see the fracture on the x-rays, and so he actually called his colleague to come in and give it a second opinion, and they were both like, okay, yeah, this is healed, but this is really fast. So at this point, he said, okay, you just need to do some rehab massage. And just as a summary, the doctors were very surprised. They prescribed 8 weeks of cast, but after successful coMra therapy treatment, the bones had fused twice faster than the expected time. And of course, the man who had the fracture is very happy to be back to normal in half the expected time. So I want to say thank you for following along, and I trust this report will be of use to you or someone you know. And a very special thank you to Ms. Yuniya Trenko. We'll see you next time.